everyone to a new interview for the HEART project. I'm Giuseppe Martone from EHMA, the European Health Management Association, and today I'm joined by Professor Rich Mitchell, Professor of Health and Environment at the University of Glasgow.
Hello.
So, Rich, I'll start with the first question, which is related also to your career evolution a little bit. Because your career has evolved from studying health inequalities to exploring how environments, especially green spaces, protect and improve health. So could you share how your understanding of the connections between social factors and environmental contexts have evolved over time?
Sure, it's a really interesting question. So I originally trained as a geographer. My first degree was in geography. And in geography, we spend a lot of time discussing the relationship between social, economic, and environmental factors. And in that world, we understand that these factors construct each other. So your social identity, your behaviors are related to the environment that you're in, but they also help to shape the environment that you're in. And so when I finished that, and then I moved into training in epidemiology and public health, it was a bit of a shock because certainly in those days, and it was a long time ago, environmental epidemiology was really just concerned with seeing environment as an exposure that happens to people, and was almost exclusively focused on things in the environment that hurt you. So a lot of work on air pollution, for example, noise, those kinds of traditional environmental epidemiological exposures. And so right from the start, I was pushing against that and trying to get epidemiology into a position where it understands that this is a complex relationship between people's identity and characteristics and the environment they're in. And then I spent a long time mapping and exploring geographical variation in health and looking particularly at the consequences for health of disadvantage, of poverty. And that was immensely depressing because it didn't matter how much we pointed out the fact that these inequalities existed and that they were largely being driven by social and economic conditions. No one did anything about them. And so I discovered quite by chance, actually, by working with some people in a forestry organization, the idea of green space and health. And I immersed myself in the literature. And I was very lucky to be involved in some European projects at a very early stage in my career. And I met lots of the key people. And that really opened my eyes to the possibility that environment could be a means of helping to reduce social inequality. And some of the initial work we did on that, I don't think anybody had really asked a question before in an epidemiological way about the relationship between exposure to nature and green space and positive health, but also crucially health inequalities. So that's really the kind of journey that I undertook. I started off understanding that social and environmental characteristics constructed each other. Then I spent some time in a world where everybody thought of environment as a threat to your health. And I hope that I've pushed the discipline towards thinking of environment in a different way and to understanding that it can help reduce social inequality, but still to understand that people and environment construct each other.
And talking about green spaces, we know that they play a big role in reducing health inequalities. So how does access to these spaces impact population health, especially for marginalized groups? And as part of your work, what evidence have you found about their role in narrowing these health disparities?
Okay, so let's take the relationship between green space and health, first of all, and leave inequalities aside for a moment. So I think there is very strong evidence from a whole different variety of study designs that contact with nature has positive health impacts. So at an individual level, and these studies are important because they confirm causality and to some extent mechanism. There are lots of environmental psychology experiments where we take people into the woods or to the park and we measure their physiological and psychological response. And those are important studies because they reassure us this is a causal effect. At population level, we see a lot of what we call observational studies, where people use lots of statistics and surveys to see an association between the amount of green space or access to green space, or sometimes use of green space in the population, and health outcomes. And we see, again, relatively consistent and relatively strong beneficial associations. So, for example, we see impacts on mental health. We see impacts on a whole range of other health outcomes, respiratory health, and so on. Where I think we still need some more evidence are in natural experiments. So we observe these associations, but we always worry that maybe it's just healthier people who are more interested in having contact with nature, who live in the parts of cities where they can do that. And so we worry that it's not a true causal effect at population level. And that's why longitudinal studies and natural experiment studies, where something changes in the environment and we observe the effects over time, are really important. And we still need to see more of those studies, but the studies that there are do suggest a positive causal effect. Now, in terms of inequalities, we have over 100 studies now which have asked that question. Do we see a reduction in health inequalities? That is the gap in health between more and less advantaged people in areas where we have better access to green space and natural environments. And generally speaking, there is relatively strong support for that observation. What we still don't really have are experimental studies, either at an individual level or at a population level, which prove causally that if you improve access to green space or you get people to have more contact with nature, that the inequalities will reduce. So that's where I think we are in the discipline. Lots of people are asking the right questions. We still need better quality study designs to be absolutely certain that green space does indeed reduce inequalities. This, what we call it, is equigenic, that it literally creates equality.
So in the next question, we look also a little bit at the innovative tools that you've been using also as part of your work, like wearable technologies and GIS. So how have these methods improved our understanding of the link between urban environments and health? And also, what potential do you see for these technologies moving forward?
So these technologies have been really useful. I think it's worth thinking about the world before we had these devices and technologies, and how did we think about environment and health before that? And what we used to do really was work out where someone lived or worked, and we would look at the environment around that location, and we would look for associations between health and behavior and the environment around that location. The problem, of course, is that humans move around, and so the potential for exposure misclassification was massive. And the great thing about GPS devices is that we get a sense of how people use environment and where they go in their everyday lives in normality. And so, for example, we've worked particularly putting these devices on children and understanding where they go, what they do, and therefore the environments they're exposed to has altered our understanding of, for example, the magnitude of inequalities. So, for example, we did quite a lot of work comparing the size of the inequality in exposure to alcohol and tobacco retail, shops that sell those things, if you measure the inequality based on the child's home address, compared to if you track where they actually go. And of course, different kinds of children from different kinds of backgrounds use urban environments in different ways. And so what we observed in that study is a much bigger inequality when we actually measure where these children go. To give you another example, we also looked at exposure to advertising of different kinds. And using GPS devices, we were able to track which adverts or what kinds of adverts children had walked past and may have interacted with. And what we were able to identify there was it was the case that children from more deprived circumstances saw more unhealthy advertising to a greater extent. It wasn't because the advertisers were putting their adverts in particular parts of the city. It was because those children used the city in different ways. They were more likely to use public transport, for example, and that's where advertising tends to be in a city like Glasgow. So these technologies massively improve our ability to understand the interactions between people and their environment, how their environment is used, how much time they spend in different kinds of environments. What they don't do so well is, because of the nature of these data, because they're very disclosive, obviously it's a breach of privacy to have a device that's tracking you all the time. So we are necessarily limited in our understanding of health for people who wear these devices. And as we increasingly use mobile phones to track people, and the privacy concerns there are understandably significant, what we're seeing in this wearable world is ever-increasing detail and ever-increasing quantity of data over where people go, and that's great, but no real increase in our ability to connect that information with individual level health outcomes. And so that, I think, is going to be a limit. There's going to be a limit there on how useful these data are. Because if you're an epidemiologist like me, you want to make that connection between environment and health and behavior. And privacy concerns make that difficult with wearables.
So as part of your work, you've also been engaging with different kind of stakeholders, like the policymakers or practitioners or the general public. So what strategies have worked best to ensure that the community voices are included in research and policy? And could you also share some examples of where this approach you feel like made a real difference?
Sure. So this is an example of a huge change in how we do science over the course of my career. And it's so important and so welcome to include the public's voice, marginalized groups' voices, but also third sector, private sector, and government sector in our work. The best strategy, I think, is to have these groups involved right at the start, before you've even got the money to do the research. They should be helping shape what the questions are, how the science will be conducted. They should be helping interpret the results. I'm not asking them to do the analysis, but at least help us shape what kind of questions we ask of the data we collect. And they can be incredibly useful in interpreting the results that we get. And also, they should be part of disseminating and using that information. And I think that reaches then into open science. So the point of doing the science and creating these data is to enable other people to use them. So it's really important to have these groups involved right at the start. And in order to do that, you have to have connections and build those connections over long periods of time. You have to establish trust. And so, for example, here at the University of Glasgow, we work very hard with our local communities to invite them into our offices and our labs so they can see what we do. We can hear about their lives. They can hear about our lives. And they can help shape the work, even sometimes before the research ideas are formulated. So perhaps the best example from my career of working with people from outside academia has been my relationship with Scottish forestry agencies, Forestry Commission Scotland, Scottish Forestry. And that's a relationship that we've built over a long period of time, so many years. And we've worked on them with a number of projects, and they've asked us questions. They've asked us to solve problems for them. We've asked them to steer our research. We've provided information for them. They've given us data. And every time you have one of these connections, it builds a bit more trust and understanding. And this culminated in us working with them on a really big natural experiment in which we had sufficient trust from them to be able to ask them to intervene in the forestry environment in some communities, but not in others. So it wasn't quite a randomized trial, but it was a controlled study over quite a long period of time. And they wanted to know the answer. They wanted to know whether their interventions in the forest made a difference. We would only have been able to do a study like that, which remains just about the only one in the world. We would only have been able to do that with that trust that had been built up over many years.
When it comes specifically to policy, how do you think that the growing body of research on blue and green spaces can be used to shape policies that promote health and reduce inequalities? And what key indicators or metrics you think that policymakers should focus on when they're evaluating the health benefits of urban green infrastructure?
Okay, interesting question. So there are so many different kinds of policymaker operating at different levels. And I think the kind of evidence and the standard of evidence required is different for different sorts of policymakers. So if, for example, you are a physician or a doctor, and the kind of evidence that you might need to use prescribing walks in nature rather than prescribing another kind of medicine is at a different standard to perhaps a local authority council member who might just need to know that generally green spaces are good for health and a positive thing. So one of the things we can do is to listen to our policymakers about what kind of evidence they actually require. That said, in terms of the metrics, scientists love to argue over what should we measure and how should we measure it. I think the key thing to understand is that it's important for every green or blue space intervention in an urban area to somehow be evaluated. And so exactly which metrics we use probably isn't as important as the fact that we should use some. So whether that's monitoring what kinds of spaces we have in what locations and how that changes, right down to actual use, who is using this space and how and why, through to measuring changes in health, in population health, which we can do through things like measuring prescriptions or using our health service data. The key thing is to make sure that we do monitor and measure. And we can argue over exactly what we monitor and measure according to what the intervention is and what the setting is. But the most important thing is we must measure it in order to demonstrate those benefits. Or find out it doesn't work. But it's important to know either way.
And finally, looking ahead with the challenges and new trends like urbanization, climate change, and increased inequalities, what do you see as the top research priorities for ensuring fair access to blue and green spaces? And how can collaboration between different disciplines support these efforts?
I think I would choose 2 or 3 priorities in no particular order. The one that worries me the most is the move to densification of cities, because the climate change scientists argue that if the cities are more compact, carbon emissions will be reduced. And they are correct. The evidence suggests that is true. The problem is all the other adverse consequences of densification. And so we know that denser cities are noisier, more polluted, more stressful to live in. It's hard to get a decent living space. And what's happening is that green spaces and blue spaces are being squeezed out by the need to densify. So the urgent priority is to adequately measure the balance between trying to reduce carbon emission, which is of course extremely important, but also maintain population health. And I wonder if there might be a sweet spot, the right amount of densification, and more research to understand how much green and blue space is required in those settings, what configuration works best, so that we can make living in these spaces tolerable for the residents. So I think that's really important. And interesting, as we move to electric vehicles, the carbon emissions particularly from cars and transport that were such a concern for climate scientists ought to reduce. And so that's something we really need to understand and model. I worry we're going to create urban environments that are miserable and people will not be healthy in them. So how do we balance that against combating climate change is a key priority. The second priority for me is trying to understand and produce causal evidence for the equigenic, that is the effective reduction of inequality aspects of green and blue space. I feel that if we create green and blue spaces or we improve access to them, that will have a causal effect on inequalities. So that's a priority for me. And then lastly, I'm increasingly interested in the use of urban green and blue spaces in a therapeutic context. So for example, in the UK, we have an incredible mushrooming population health problem. with an aging population that is sick. And I'm increasingly interested in the way that green space can be woven into healthcare to help people prolong or push off the need for treatment and to recover from treatment more quickly. So the idea that the green space might be the hospital or clinic in everyone's neighborhood, I think is really interesting. So those would be the priorities for me.